Hi, I'm Helen Epstein, and I welcome you to our program today. Today I have the pleasure of introducing you to Dr. Ed Masterson of Masterson Chiropractic, a local chiropractor, and my chiropractor. He will tell you a little bit about himself and about the practice of chiropractic. Welcome, Dr. Ed.
Thank you very much, Helen, for having me.
Okay, so how long have you been practicing chiropractor?
I have been practicing for over 22 years.
You started as a young boy.
I'd like to think so. I started when I was in my early 20s. I began classes at local colleges and went to Stockton State University, and eventually I found my way down to Life University in Marietta, Georgia.
And that's where you got your studies?
That's where I got my studies.
So what inspired you to become a chiropractor?
My mother actually was a big inspiration to me. My mother was a registered nurse for almost 40 years. And I can remember as a young person discussing a lot of her cases, and a lot of them included back and neck problems, as well as her own issues with back and neck problems. And so we had discussed, my path going forward, and chiropractic seemed to be very fitting for me. Because
even though she was more connected to the medical community.
That's right, that's right. And I asked her about it, and I said, Mom, I don't know that I want to, cut anybody or prescribe drugs. I said, but, I'm a root of the problem type person, and I think chiropractic would fit me very well in that regard.
Yeah, different things, definitely at that time thinking out of the box.
Yeah.
Because usually people have a back pain and problem, they go to the doctor and they get a shot or a pill.
Yeah.
And they don't get to the root of the problem.
They don't. And it's unfortunate, but a lot of those remedies don't have very good success rates.
It's a Band-Aid, kind of.
Yeah, absolutely. And as we know that most people know this, you can't live on painkillers.
Yeah.
So.
But this is what doctors tend to do. There's a prescription for the pain. If there's a reaction to the prescription, there's a prescription for that. I've seen it happen, and after a while you're just so over-medicated.
That's exactly right. Liver, kidney problems, these are things that we see time and time again with people who live on painkillers. Ulcers, those are just, situations we don't want to find anybody in.
Right.
And especially,
there's a place for medication when it's needed.
Right.
But these being
temporary use.
Temporary use, not a lifetime.
Cannot live on painkillers.
So going back to schooling, how many years of schooling is required for a degree?
At this point, it's a 4-year degree, and then your graduate is about 3.5 years, so almost 8 years total. We have a very, very similar number of hours as far as diagnostic and basic anatomy and physiology as any medical doctor.
Yeah,
actually, we have more so in diagnostics, but where we differ is in the prescriptions. We don't do any type of things that require us to know drug interactions.
Which, if you were in medical school, that's the route you would take.
Right.
So you're kind of veering off the other way.
We veered more off of how to adjust the spine in a way that's proper and getting the best results available.
And you told us where you went to school, Life
University.
Life University, yeah.
Yep, Marietta, Georgia.
So, as opposed to medical treatment, if I came to you with a neck problem or a back problem, it's not a one-shot deal, which is, I think, what many people say is, well, I went to a chiropractor once and he didn't help me. It's a series of treatments to get to the point where your spine or your neck, whatever, is in good condition.
That's right. Chiropractic care And I think this is a great opportunity for me to kind of clarify some things. Chiropractic care is not unlike physical therapy in that, yes, it takes several adjustments to get you where you want to be.
Right.
There's no avenue in life that you can do something once and yield those type of results. You can't go to the gym once.
Yeah.
You can't eat healthy just once.
Yeah, that's true. If
And you
people
can't
would
brush your
think
teeth
like
just once.
Yeah.
Right?
Yeah.
So we have to understand that chiropractic is not a pill. It is more like the physical therapy or life avenue that you're taking an approach to now when you go to chiropractor. And you will feel better a lot of times after your first adjustment, but in order to keep those results going,
Right.
that's where things differ.
Yeah. You have to commit to a life.
Yeah, it's a lifestyle. It
treatment.
definitely is a lifestyle.
Yeah.
For certain.
Yeah, as I say, people are used to a quick fix. You know, I have a sore throat, I'll go to the doctor, I'll get a prescription, and eventually I'll feel better.
Right.
But something like that affects your whole body, that's not going to happen so fast. You know?
Well, think of it this way too. Most conditions that occur in your neck and your low back have transpired over time. Bone remodeling, things like that, bad posture. I tell people all the time, raise your monitor,
Right.
carpal tunnel.
Sit up straighter.
Sit up straighter.
Yeah.
Unfortunately, we do things the wrong way for a long time, and then we have to have it fixed.
Yeah. Do chiropractors ever give classes to their patients, on just what you're saying?
Yeah, we do what's called a lay lecture. And we just kind of bring these points to life and say, hey, this is where you were, this is where you're at, and this is why. And a lot of people are very interested.
Yeah, so that they'll commit themselves to this type of lifestyle.
Yeah, absolutely. And once they start feeling better, they seem to they get greedy for it. They want to feel even better.
Of course, everybody does.
Yeah,
right.
and that's exciting. That's one of the main reasons I became a chiropractor, was just to help people and have a better quality of life.
And I know there's something new that, because my daughter's a chiropractor, is where I first heard about it. It's this therapeutic laser treatments, which is part of your practice now.
Yes.
So can you talk a little bit about that?
Yeah, absolutely. Therapeutic laser is very, very exciting. I learned about it about a short time ago, about a year ago, and what I've come to understand is it fits under the chiropractic umbrella. In other words, laser is natural. It's a form of light that's amplified and used in certain joints, such as your neck, your shoulder, your knee. And what the laser light does is it interacts with the cells and gets them to regenerate. While it's doing that, it creates a analgesic effect, which is a pain relieving effect. So people really have taken very well to it. Oh, and by the way, no drugs, no surgery.
Yeah.
Right?
Which is a major plus right there, right?
No shots.
Right.
People don't want shots, and they don't want to live on drugs, and they don't want to have surgery. So laser really helps that.
So that's a program of so many treatments?
Yeah, unlike chiropractic, it's a little bit shorter regimen. It's usually about a 6 treatment regimen. And like I said, the results have been astounding.
That's what I've heard, yeah.
Yes.
So it's cold or hot? When you're getting the treatment, do you feel the heat or the cold?
You do feel a little bit of a warm sensation, and it's soothing. It feels good. That's the topical sensation, but what we don't see, unless you understand laser fully, is it actually goes down about 1 inch to 1.5 inches into the joint, which really increases that healing factor, like we were talking about, 1,000-fold. So all the cells in the area are now being accelerated.
Yeah.
And things like ATP, a lot of technical terms, but basically you're supercharging the cells. Almost like a solar panel receives light and
Absorbs.
interacts and absorbs, it creates more energy in the joint. And the results are amazing.
And you're getting that feedback from your patients.
Yes, yes. I've had several patients who have come in with knee pain, and one in particular was all set for surgery and decided he was not going to have surgery after his first 6 sessions of laser.
Really? That's the level of improvement.
That's the level of improvement.
Wow.
Laser has been an amazing addition to our office. So what I like to do is tell people, look, if you have a problem with your spine, chiropractically we will fix that. If we have a problem with the discs in the spine, we will use laser. If you have a shoulder, knee, elbow, wrist, we can go right to laser. We don't have to send you
Along with chiropractic.
along with chiropractic. We don't have to send you down the street to get a shot or have a surgical consultation. We can take care of it right then and there in the office.
And you're getting a good response. You suggest it to your patients.
Yes, and here's the great part. We offer a complimentary free laser sample to everybody, all of our patients. These are the cards that show that.
Yeah.
And you could recommend it to your friends.
I have
it's
done
free.
that, yes.
It's great because that's how much we believe in it, and that's how much we have seen the success of it. So it's really, really exciting.
Yeah.
It really is.
And that, as you say, is fairly new. I know my daughter's been using it for about 2 years, and she said she gets amazing results from it. So.
Yep, we're looking forward to continuing to help as many people as we can with it.
So you brought this little spine thing. Is there anything we can see on there that can explain how chiropractic works?
Sure. So chiropractic care is very simple. I know it's a little dry outside.
Yeah.
Chiropractic care is very simple. What we'd like to do is find where, in fact, the spine is misaligned, and we like to realign it.
Okay.
That's number one.
Manipulation.
By gentle chiropractic manipulation, or we like to say adjustments.
Okay.
Okay? So we're adjusting specifically 1 or 2 segments. And all of a sudden, you get the pressure taken off the nerve. So you feel
where the pain comes from.
right, you feel better, which is really an amazing outcome. For somebody who's been living in pain, it's an amazing outcome to get an adjustment and get relief.
Absolutely, yeah.
It's like magic.
I think people get used to the pain sometimes, and it becomes a way of life, and they,
Yeah, it's interesting, Helen. I've had people come in who have never been to a chiropractor, who've been in pain for 10 years, and I adjust them, and they get up and they say, "Oh my God,
I feel better.
I feel better. I should have done this 10 years ago."
Yeah.
But because they didn't know about chiropractic, some people are afraid of what they don't understand.
Yeah, that's right.
But once you understand it, there's nothing to be afraid
Well,
of.
you have to open your mind up to a little bit of education about it, and people say, "I'm not going to let him crack my neck and my back," and they are afraid of it.
But once they understand it, it's like anything else. My father's in his 80s. I never thought he was going to do online billing. All his bills are online now.
How do you like that, right?
Ironically,
you can learn at any point in life, right?
You can.
Right.
You never lose the ability to learn. And once you learn about chiropractic, it really is just like any other healthcare, and it's absolutely 1,000% safe. Actually, safer than going to a medical doctor.
In many cases, I'm sure it is. And if you can avoid surgery, I mean, like, who wouldn't want to do that?
Right. And if you're having issues such as disc issues, it's better to get it early than later. So I recommend anybody to get a chiropractic exam and see where they fall into the category of getting adjusted.
These classes that you briefly spoke about, do you do that as a routine
Yes.
kind of thing, so that people can get more educated?
Yes, I absolutely do. Every so many months, we schedule a lay lecture, and we have whoever's available. Quite honestly, a lot of retirees who are able to make it, and we have snacks, and we have some, refreshments.
Well, there you go. Say the right word.
Yeah.
Food.
And what's interesting about lay lectures is afterwards, I'll usually get a patient or somebody, a friend of a patient, who comes with them and says, "Hey, doc, can I talk to you?" And I said, "Oh, yeah. I've been meaning to come to a chiropractor for years. I'm so glad that you explained it to me."
Yeah, I think that's the first step, really.
Because now you've taken away all my fears.
Yeah.
So it's a good tool to get people
Yeah,
worried
it's
about
good
it.
to know. I'll spread the word, certainly, because the reaction you get from certain people is, no, I wouldn't
Right.
I'd never go to a chiropractor.
Yeah, oh yeah.
Yeah.
We've heard that for years. Unfortunately, chiropractic has become a mainstream therapy, I would say.
Yeah.
Right behind, I would say, medical, it's the third in line at this point. So in 129 years, we've come a long way.
Wow. When I first started 40 years ago, it wasn't covered by insurance. They didn't recognize it as a health treatment.
Wow.
And that changed over time, but they didn't. The profession didn't recognize chiropractic as a healthcare, procedure. So yes, that wasn't 129 years ago, almost, but not quite.
But we're getting there. I think that society in general, people want more natural alternatives everywhere you look. And certainly all of the patients that come into my office, they'll just tell me, "Doc, I don't want to get any more shots. I don't want any surgery."
Well, they've set their mind at this point to
Right.
an alternative method.
Yeah, they have really opened their mind because unfortunately they've kind of been forced to. There's running out of alternatives, and I'm happy to take care of everybody.
Well, we'll hope that that happens, that you'll be so busy that you'll remember it was because of this.
That's right.
Anything else that you want to enlighten our public about?
I think we've covered all of our topics. Just as a parting statement, I should say, chiropractors. I just want to make sure that everybody's clear on it. Chiropractors don't treat symptoms. We treat the cause.
Right. That's the major difference, yeah.
That is the major difference. We're trying to treat the cause of the problem. And the symptoms go away after you treat the cause. And unfortunately, too many people think it's more like a Band-Aid, but it's not. You're treating the cause. It's not a Tylenol.
So the result doesn't return. That's the idea, yeah.
And then the last thing I would say is, people say, I've heard this 1,000 times, and I laugh every time. Well, once you go to a chiropractor, you have to continue to go. I don't know if you've ever heard that.
It's similar, yeah.
Okay. So my response to that is, you have to brush your teeth every day, right? You have to go see your medical doctor every 6 months, right? Women need to see their gynecologist every 6 months, or so they should. There are certain things in life that we have to do.
Yeah.
You get your oil changed in your car.
Yeah,
right?
to maintain the level that you want, yeah.
Exactly.
Yeah.
So my message to everybody is, in your spine, you have 48 joints. That's a lot of things that can go wrong. Right? Just like a car, the more sophisticated it is, the more you have to take care of it because you want it to run optimally. You want it to run perfect. So why not take care of your spine like it's the most important thing you have?
Yeah.
Right?
And it's like I do maintenance. You don't have to have a major problem to go to a chiropractor.
That's right.
I try to maintain whatever level of health I have. I mean, the aches and pains are going to be there at some, as you grow older. But to maintain a good quality of life, I think that's what my chiropractor fits in.
You know what? The phrase you just used is perfect. Maintain a quality of life, right? Eat right, exercise, get your spine adjusted.
Do the best you can do to keep yourself going.
Do the best you can do.
Yeah.
And that really, that kind of engulfs the chiropractic lifestyle. Just take care of yourself, take care of your spine. I think that's...
And you have 2 offices in Ocean County, right?
Yes, I do. I have one on Route 70,
Right.
147 Route 70, Suite 2. It's over by, not Leisure...
Lake Ridge.
Lake Ridge.
Yes.
And if you go into the Lake Ridge entrance, instead of going through the gate, you just make a left and
Yeah.
you're in the mini mall.
That's right. Very, very easy to get into.
My other office is down in Galloway, right on Jimmy Leeds Road, 542 Jimmy Leeds Road.
So you split your time?
Split my time. Mainly I'm focused on Tom's River. The other office is more of a satellite office.
You do laser treatment in both places?
We do. We do.
Okay.
We've had such success in the Tom's River office with laser that, and I never thought this would happen. I said, I'm going to buy another laser. So as you can imagine,
Expensive machines.
they're a little expensive.
Yes, I've heard.
But definitely worth it because when you see somebody who could barely lift their arm and now they can go like this,
Yes.
it really is exciting.
You know, that's what people have to understand.
Yes.
To improve their quality of life. So let's give them the phone number, which is both offices, or
This
we're
one is
going to deal
fine.
with
The 732?
732-370-3300. Dr. Ed Masterson. I hope he's enlightened us today. We touched on everything that you want to
I think
want
so.
public to know.
I think so. I
And-
thank you so much, Helen, for inviting me. This was
Well, it's a
this was
pleasure.
amazing.
I mean, I am a very strong proponent. I've been doing this for years, so you know that I'm a
Yes.
proponent of chiropractic. And I thank you for coming and enlightening our audience. I hope that people have learned something from you, and maybe we'll call and get in on one of those classes. I think that would be interesting.
By all means, call up, come in for a free consultation
A free laser
and a
treatment.
free laser treatment.
There you go. And get an introduction to it
Yes.
before you say no.
Come in, write your questions down, conquer your fears, get better, take advantage of everything life has to offer.
Exactly.
Really, it's
That's
here.
the bottom line.
It's ready to go.
Okay.
All
Thank
right.
you. Thank you so much. I appreciate it. I'm Helen Epstein. I thank you. I hope you learned something today, and I thank you for watching our program.
Thank you.